Good evening, guys. Once again, this is Dr. Paul, serving humanity through medical education. Welcome to our website at www.usmlevideos.net. That is www.usmlevideos.net for more videos discussing so many different subjects. Especially, we discuss the most important topics for USMLE examination. So let us look tonight at one of the very commonly tested topics, that is SSRI discontinuation syndrome. Now, what is SSRI discontinuation syndrome? How does this come on the examination? The case scenario will be like this. A 30-year-old male, he called your office. He is complaining of dizziness, nausea, vomiting, flu-like symptoms. He cannot sleep. You asked his history. The history says that the patient has been on paroxetine for his depression for like 10 years, and you stopped that medication like 5 days ago. So 5 days ago you stopped paroxetine, and now he is complaining nausea, vomiting, dizziness. What is your management? A. Hospitalize the patient. B. Restart paroxetine. C. Give him some antiviral medication. D. Give him a flu shot because he is complaining of flu-like symptoms. E. Tell him that symptoms will resolve. What is your answer? The correct answer is E. The symptoms will resolve. You don't have to hospitalize. You don't have to restart on paroxetine. You don't have to give a flu vaccine or antiviral medications. The answer is the symptoms are going to resolve. So let us talk tonight about SSRI discontinuation syndrome. You see, most of the SSRIs, they are good medications. But if you stop them abruptly, certainly the patient is going to have discontinuation syndrome. And most medications, most SSRIs have mild and self-limited problems, but some medications have severe problems. That's why not every SSRI is associated with mild withdrawal syndromes. For example, mild, moderate, severe, you need to distinguish, because SSRIs have different half-lives. So if a medication has a long half-life, the patient will be able to tolerate it more when you discontinue it suddenly. But if the medication has a short half-life, the discontinuation syndrome will be severe. That's why for a patient with fluoxetine, for example, the discontinuation syndrome will be mild. For a patient whose sertraline was stopped abruptly, there will be a moderate discontinuation syndrome. But paroxetine causes a very severe discontinuation syndrome. So these discontinuation syndromes are mostly associated with with the particular medication. So think about particular medication when you are answering these questions. So the best mechanism is to slowly taper the medication, like 25% every week. For example, if the patient is on 10 milligrams this week, next week 7.5, next week 5, after next week 2.5, and then you can discontinue. Slowly taper. That applies to all these medications, all SSRIs. Venlafaxine, it also causes discontinuation syndrome, like dizziness, anxiety, flu-like symptoms. And if you go up the ladder, heterocyclic antidepressants and MAO inhibitors, they cause much dangerous discontinuous syndrome than SSRIs. Those patients will have delirium, agitation, and myoclonic jerks, and insomnia, and all those problems. So whenever you taper these SSRIs, you should educate the patient against abrupt discontinuation. Otherwise, the patient has to suffer these problems. And you need to remember the exact medication also. Is it fluoxetine? Is it sertraline? Is it paroxetine? What is this medication? Which medication are you going to stop? And when the patient complains of severity of symptoms, you should think about what medication he actually stopped. If it is a MAO inhibitor, admit him, because he is going to have those severe agitative myoclonic jerks associated with delirium. If the patient is especially an elderly person, then the symptoms will be severe. But for common SSRIs, you have to tell the patients just to hang on until the symptoms resolve. And especially for medications like fluoxetine, the discontinuation syndrome is very mild. So that's about SSRI discontinuation syndrome. As always, this is Dr. Paul, and you can visit our website at www.usmlevideos.net and post your comments on these blogs, and you can actually post your comments on our website also at www.usmlevideos.net, where everybody could read your comments. And if you feel that I left something unanswered, feel free to mention it. You're always welcome to post your comments. That's it for tonight, and this is Dr. Paul, and I wish you all the best on your medical examination. Thank you.